All right, let's do this. Hypothyroidism, we're coming for you. We're going deep today, way past the basics, like what the thyroid does and all that. But what happens when it goes off the rails? We're using this up-to-date excerpt, by the way, super detailed.
Yeah, it gets pretty wild. We're talking all the different types, the common ones, the super rare ones, the what causes it.
Okay, so primary hypothyroidism, that's where the thyroid itself is the problem, right?
Yeah.
Like, what if someone has their thyroid taken out? Are they, guaranteed to end up hypothyroid?
Yeah. Taking it out surgically, that's definitely going to lead to hypothyroidism. No thyroid, no hormone, right? And that actually brings up one cause of primary hypothyroidism damage from, medical treatments. It's not just surgery, though.
Right.
Like radiation to the neck, that can mess with the thyroid, too.
Okay, but hold on. Isn't radioactive iodine what they use for hyperthyroidism when it's overactive? So wouldn't that eventually also cause hypothyroidism?
You're totally right, it can. And it's actually
Sure.
one of the more common causes, especially here in the U.S., where we get enough iodine in our diet. But the most common cause here is actually Hashimoto's thyroiditis, autoimmune thing.
Hashimoto's, yeah. Rings a bell. That's when your immune system attacks your thyroid. Right.
Exactly. And it's way more common than people think. Over 90% of Hashimoto's patients, they've got these antibodies targeting specific proteins in the thyroid. And here's the wild part. It can go two ways. Goitrous, so the thyroid gets all big, or atrophic, meaning it shrinks. Either way, same result, not enough hormone.
So wait, your body's attacking itself. That's kind of messed up, isn't it? And isn't hypothyroidism, especially Hashimoto's, more common in women? Is there a reason for that?
It is pretty strange when you think about it. Researchers are still trying to figure out exactly why the immune system targets the thyroid like that. And yeah, you're right, way more common in women, even more so as they get older. It's probably this mix of genes and hormones, but the specifics still being studied.
Okay, so Hashimoto's, medical treatments, lots going on. But what about iodine? That's like thyroid 101, right? But this article said too little and too much can be bad. Explain that one.
This is where it gets cool. So iodine, it's a building block for thyroid hormones, right?
Yeah.
Worldwide, not having enough iodine, that's actually the #1 cause of hypothyroidism. Right. And this is but getting too much iodine can also mess you up.
Seriously. Too much iodine is bad. I thought it was the more the merrier. Maybe I need to ease up on the seaweed snacks.
It's all about balance, right?
Yeah.
Too much iodine, and it can actually block your thyroid from making hormones. It's not just about getting enough, it's about getting the right amount. That really changed how I thought about thyroid stuff.
Mind blown. And speaking of things that can throw off iodine, some meds can interfere with the thyroid too, right?
For sure. Lithium, that's used for bipolar disorder, that's a big one. Amiodarone, that's for heart rhythm problems. That can also mess with thyroid hormone production. And there are others, interferon alpha, interleukin 2, those are sometimes used for cancer treatments, and those can have an impact too.
It's crazy how these drugs meant for totally different things can end up hitting the thyroid too. It really shows how connected everything in the body is.
Absolutely.
Yeah.
And then there are the less common causes, but still super interesting, like infiltrative diseases, where other stuff builds up in the thyroid and messes with how it works.
Infiltrative diseases, that sounds kind of intense. What's actually happening there?
Think of it like fibrous tissue growing inside the thyroid, like in Rydell's thyroiditis, or too much iron from hemochromatosis affecting the thyroid cells. Even things like scleroderma or leukemia can sometimes impact the thyroid. Really makes you appreciate how connected everything is.
Okay, so we've got Hashimoto's, medical treatments, iodine issues, certain meds, and now these infiltrative diseases. Anything else we need to know about primary hypothyroidism?
Well, there's a little twist. Sometimes hypothyroidism can actually be temporary.
Temporary, really? That's a new one. Tell me more.
It usually has to do with certain types of thyroiditis, which is just inflammation of the thyroid.
Inflammation. Okay, I'm following.
So there's silent thyroiditis, often happens after pregnancy, and subacute thyroiditis, which can be triggered by a virus. And here's the kicker. Some people, they actually go through a hyperthyroid phase first, like too much hormone, before swinging into hypothyroidism. It's like a hormonal roller coaster.
Whoa, that's wild. But if it's temporary, does that mean it just goes away on its own?
Most of the time, yeah. With those types of thyroiditis, the inflammation usually calms down over time and the thyroid bounces back to normal. But obviously, it's important to keep an eye on things and work with your doctor, manage symptoms and all that.
Gotcha. So we've explored all the ways the thyroid gland itself can be the problem. But what about those secondary and tertiary types you mentioned before? Those sound like a whole other ballgame.
They are. We're moving from the thyroid itself up to the brain, Now, the pituitary gland and the hypothalamus,
Hold up, the brain is involved in thyroid stuff. I had no clue.
big time. The pituitary, it makes TSH, thyroid-stimulating hormone, which basically tells the thyroid how much hormone to make. And the hypothalamus, that's like the brain's control center, it regulates the pituitary by releasing TRH, thyrotropin-releasing hormone. Think of it like a chain of command, hypothalamus to pituitary to thyroid.
So if something goes wrong higher up with the pituitary or hypothalamus, that can also cause hyperthyroidism.
Exactly, and that's what we call central hypothyroidism. Less common than primary, but still important.
Okay, so what kind of things can go wrong with the pituitary or hypothalamus to cause hypothyroidism?
Well, pituitary tumors, for one, they compress on the pituitary, mess with its ability to make TSH. Then there's Sheehan syndrome, super rare, but it can happen after childbirth. It's damage to the pituitary from like blood loss or really low blood pressure during delivery.
Sheehan syndrome. Never heard of that one. That's pretty scary. But could, like, any kind of head injury potentially affect thyroid function?
Yeah, anything that messes with the pituitary or hypothalamus could disrupt that whole chain of command, potentially leading to central hypothyroidism.
So is central hypothyroidism basically the same as primary, just a different cause?
Not quite. You still end up with low thyroid hormone levels, but central hypothyroidism can be harder to diagnose. See, with primary, your TSH is usually high because the pituitary is trying to kickstart that sluggish thyroid. But with central, your TSH might be low or even normal, even though your thyroid's not producing enough.
That does sound tricky. It makes you realize thyroid problems aren't always so straightforward. Anything else that makes central hypothyroidism different?
One big thing is that you often have other hormone deficiencies too. The pituitary makes a whole bunch of hormones, so if it's messed up, it can have a widespread effect.
Right, it's not just the thyroid that's affected. Okay, so primary, central. Anything else causing hypothyroidism?
There are a couple of super rare types we haven't talked about yet. One is called generalized resistance to thyroid hormone, GRTH for short.
Generalized resistance to thyroid hormone. Okay, I'm interested. I'm guessing this is pretty unusual.
It is. It's a genetic thing where your cells just don't respond to thyroid hormone the way they should, even if your thyroid is making enough. Like, they've become resistant to its signal.
So even if your thyroid is working perfectly, your body isn't getting the benefit. That's crazy, but wouldn't that be hard to figure out?
Yeah, it can be tricky. We'll definitely talk about diagnosing and treating GRTH later, but first, there's another rare type, consumptive hypothyroidism.
Consumptive hypothyroidism.
That sounds almost scary. What's happening there?
This is where your body breaks down thyroid hormone way too fast, usually because of certain tumors. Like the hormone is getting used up before it can do its job.
Wow, so even if the thyroid's doing its thing, something else can sabotage it. It's amazing how many things can impact the thyroid. This deep dive is really eye-opening. It's definitely more than meets the eye. But before we go into those rarer types, let's go back to those temporary cases we talked about earlier. The thyroiditis that can cause those temporary hormone dips.
Yes, let's do that. You mentioned silent thyroiditis and subacute thyroiditis. What makes them different and what should people know about them?
Both of them mess with the thyroid because of inflammation, but the triggers are different and they play out a little differently. Silent thyroiditis, also called painless or postpartum thyroiditis, we don't totally know what causes it, but it often pops up after pregnancy.
Postpartum. It makes sense why they call it that. But why silent thyroiditis? Does it mean there are no symptoms?
Not necessarily. It's silent because you don't usually feel pain or discomfort in your thyroid like you do with some other types. People might not even realize anything's wrong until they start getting symptoms of either hyperthyroidism or hypothyroidism.
So you could go from too much hormone to too little? That sounds confusing.
It can be. But the good news is it's usually temporary. The inflammation usually goes away on its own in a few months, and the thyroid gets back to normal.
Okay, that's good to know. Now, what about subacute thyroiditis? You said it might be linked to a virus. Does that mean you can catch it from someone?
Good question. So we think a virus triggers it, but the condition itself isn't contagious. It's the virus that's contagious, not the thyroiditis itself.
Oh, okay. So a virus messes with your thyroid, but you can't catch subacute thyroiditis from someone else. Got it. But what kind of symptoms does it cause?
Subacute thyroiditis, it's also called granulomatous thyroiditis or de Crevaine's thyroiditis. Anyway, it can cause more noticeable inflammation symptoms. People often have pain and tenderness in the thyroid area, plus fever, fatigue, muscle aches.
Sounds a lot like the flu. I bet that makes it hard to diagnose.
You're right, it can. And just like with silent thyroiditis, you can get those fluctuating thyroid hormone levels. Some people have a hyperthyroid phase first, then hypothyroidism, and then eventually their thyroid function goes back to normal.
Okay, so both silent and subacute involve inflammation, can cause temporary hypothyroidism, and usually go away on their own. Anything else that sets them apart?
Well, subacute thyroiditis, you tend to notice it more, especially with that pain in the neck. And while both can happen after pregnancy, silent thyroiditis is way more common postpartum.
So it seems like these temporary types of hypothyroidism really show how important it is to look at the whole picture when you're diagnosing thyroid problems. It's not just about the lab tests, right?
Totally. It's about the person's medical history, their symptoms, anything else that could be affecting their thyroid. It's all about connecting the dots.
And speaking of connecting dots, let's go back to that rare type of hypothyroidism you mentioned, generalized resistance to thyroid hormone. You said it's like the body's cells just aren't listening to the hormone signal. What does that actually look like? What kind of symptoms do people have?
This is where GRTH gets really interesting. People with this condition can have a whole range of presentations. Some people have mild symptoms, or even no symptoms at all. Others have all the classic hypothyroidism symptoms, even though their blood tests show high levels of thyroid hormones.
Wait, high hormone levels and hypothyroid symptoms? That's backwards. How's that even possible?
Because their cells just aren't responding to the hormones properly. Think of it like a radio that's playing music, but the volume's turned way down. The music's there, but it's not getting through.
I get it. The signal's there, but the cells aren't picking it up. So how do you diagnose and treat GRTH?
Diagnosing it can be tricky because of those weird blood test results. Doctors have to look at the person's symptoms, family history, other clinical findings to figure it out. As for treatment, depends on how bad the symptoms are. Some people with GRTH don't need any treatment, while others might need high doses of thyroid hormone to try to overcome that resistance.
Sounds like a very individualized approach is needed.
Absolutely. It's a complex condition that needs careful management. It really highlights the importance of looking beyond the lab tests and considering the whole person.
This deep dive has been incredibly informative. We've covered so much, from the common to the super rare. It really makes you appreciate how complex our bodies are and how even small imbalances can make a big difference.
Totally agree. It underscores the importance of paying attention to our bodies and getting checked out when something feels off, even if we can't pinpoint what it is.
Absolutely. Early detection and treatment can make a huge difference. So, before we wrap up, let's go back to that thought-provoking question you mentioned earlier. With all these different causes of hypothyroidism, what are some red flags that might make someone think, hey, maybe I should get my thyroid checked out?
That's a great question, especially because hypothyroidism symptoms can be subtle and easily mistaken for something else, especially at first.
Right, it can be really sneaky. So, what should people be watching out for? What are some clues that might point to a thyroid issue?
Well, fatigue is a big one. If you're feeling unusually tired and sluggish, and it's not just because you were up late or had a busy week, that could be a sign.
Okay, fatigue.
What else? Unexplained weight gain is another one. You're eating healthy, exercising, but the scale keeps going up. Might be worth checking your thyroid.
Right, because the thyroid controls metabolism. Anything else?
Changes in your hair or skin. Hypothyroidism can make hair dry and brittle, and skin dry and rough.
So if your usual hair and skin routine isn't working anymore, it might be time to see a doctor. What about mood changes? I've heard hypothyroidism can affect mood and energy levels.
You're right, it can. People with hypothyroidism often have mood swings, irritability, even depression. It's like they've lost their spark.
That sounds really tough. So to recap, we're talking fatigue, weight gain, changes in hair and skin, and mood swings. Are there any other symptoms people should know about?
Those are some of the most common, but it can show up in other ways too, depending on the person and how severe it is.
Like what? Give us some examples.
Some people get constipated or have other digestive problems. Some have trouble concentrating or remembering things. And some women have irregular periods or trouble getting pregnant.
Wow, the list goes on. It really does affect the whole body. But it sounds like the symptoms can be pretty vague, easily confused with other things.
That's true, and that's why it's so important to listen to your body and talk to your doctor if you're experiencing any of these symptoms, especially if they stick around or get worse.
Totally agree. Don't just brush it off as stress or getting older. It could be something more. So, listeners, if you're experiencing any of the symptoms we talked about, don't hesitate to talk to your doctor. Early detection is key. But before you do, there's one more fascinating aspect of hypothyroidism we need to explore. Remember that rare type where the body breaks down thyroid hormone too fast? Let's dive into that next.
Yes, consumptive hypothyroidism. incredibly rare, but it really shows you how complex and interconnected our endocrine system is.
Okay, so consumptive hypothyroidism sounds like something straight out of medical mystery. What's the deal with this one?
It's kind of like your body just can't get enough thyroid hormone. It's breaking it down, getting rid of it way too fast, even if the thyroid's making plenty. Super rare, though.
So even if the thyroid's working fine, the hormone's disappearing before it can do its job.
Exactly. It's like trying to fill a bathtub with the drain open. You're putting water in, but it's flowing right back out.
Ooh, good analogy. But what would make the body break down hormone that fast? Is it like an autoimmune thing attacking the hormone itself?
Not autoimmune in this case. It's usually linked to certain types of tumors. They make these enzymes that uh, basically gobble up thyroid hormone way faster than normal.
So these tumors are like little hormone vacuum cleaners.
Pretty much. And because it's so rare, diagnosing it is a real challenge. Got to rule out all the more common causes of hypothyroidism first.
I bet even the top endocrinologists are like, what's going on here when they see a case like this?
Definitely can be a head scratcher. But knowing it's a possibility is key, especially when someone has those hypothyroidism symptoms, but their lab tests don't fit the usual picture.
This deep dive has taken us on quite a journey. Autoimmune stuff, leaky bathtubs, hormone-eating tumors. It's amazing how much can affect the thyroid.
It really shows you how complex the body is and how everything's connected, and it highlights how important it is to really investigate and tailor treatment to each individual.
For sure. So as we wrap up our hypothyroidism exploration, let's bring it back to something said earlier. Early detection is key. And treatment often works really well, no matter the cause. But the tricky part is those early symptoms, they're easy to miss. So for our listeners out there who might be thinking, is this just me getting older or is something else going on? What are some specific things they should definitely talk to their doctor about?
Such a good question. Because, everyone gets tired sometimes or their weight fluctuates. But if it's persistent, getting worse, got to pay attention. Beyond those common symptoms, there are a few more red flags to look out for.
Oh, spill the tea. What are they?
One that often gets overlooked is changes in bowel habits, especially constipation. If it's sudden, doesn't get better with diet or those over-the-counter things, could be a thyroid sign.
Really? Constipation? I never would have thought of that.
It might seem strange, but thyroid hormone affects a lot of things, including digestion. So low hormone levels can slow things down, hence the constipation.
Makes sense. What else should we be watching for?
Another one is being more sensitive to cold, like you're piling on the layers when everyone else is fine, or your hands and feet are always freezing. Could mean your thyroid isn't keeping your metabolism going strong.
Basically, if you're turning to a human popsicle, go get your thyroid checked. Anything else we shouldn't ignore.
Yeah, for women especially, changes in your period. Hypothyroidism can make them heavier, longer, less regular, and sometimes it can even lead to problems getting pregnant.
Wow, that's serious. It's amazing how many things hypothyroidism can affect.
It really is. Yeah. And it shows that even small changes in your body can be a sign of something bigger. So if anything feels off, don't wait. Talk to your doctor. Better safe than sorry.
I completely agree. Knowledge is power, and understanding your body is the first step. So listeners, take this info, own it, and don't be afraid to get medical advice. And remember, even though we've covered a ton today, this is just the beginning when it comes to the thyroid. There's always more to learn.
Well said. And with that, let's wrap up our deep dive into hypothyroidism. Hope you found it helpful and maybe you learned a thing or two you didn't expect. Until next time, stay curious and take care.
All right, so before we wrap this whole thing up, we got to circle back to this consumptive hypothyroidism. It's so rare, but you said it gives us some real insights into the endocrine system. What's so insightful about it?
It really shows how connected everything is. Like, we tend to think of hormones as, just these little messengers, but it's way more complex than that. With consumptive hypothyroidism, you can have a perfectly good thyroid, making enough hormone, but then somewhere else, something's messing it all up, like a drain, pulling it all away.
It's wild to think something could be like stealing the hormone before it can even do its job. You mentioned tumors earlier. Are those the main culprits here?
Most of the time, yeah. Some tumors, they make these enzymes that just chew through thyroid hormone way faster than the body normally would. It's like a recycling center that's just like way too efficient.
So the thyroid's working fine, but the hormones are getting recycled before they reach the cells that need them. I can see why diagnosing this would be a nightmare. You could have normal hormone levels in the blood, but the person's still experiencing all those hypothyroidism symptoms.
Exactly. It really shows why it's so important to, listen to your patients, not just look at the lab results. If someone's got classic hypothyroidism symptoms, fatigue, weight gain, cold all the time, but the blood tests look normal,
Hmm.
you got to think outside the box. Consider those rare possibilities, even something like consumptive hypothyroidism.
This deep dive has been like a crash course in thyroid health,
Hmm.
seriously. We went from Hashimoto's, which is like thyroid 101, to medical treatments, iodine imbalances, and then those super rare ones like that resistance to thyroid hormone and this consumptive hypothyroidism. One condition, so many different causes. It's amazing.
It really shows you how complicated our bodies are, how everything's intertwined. And it stresses the importance of, a thorough workup, figuring out what's really going on so you can treat each person the right way because no two cases are the same.
Absolutely. So, for our listener who's been diligently taking notes this whole time, what are the big takeaways? What should they remember from all this?
I think the main thing is hypothyroidism, it's more than just an underactive thyroid. There's so much more to it. Autoimmune stuff, treatments, genetics, even those rare tumor-related things we talked about.
Hmm.
And the symptoms, they can be sneaky, easy to miss. So pay attention to your body, and if something feels off, talk to your doctor.
Couldn't agree more. Don't be afraid to ask questions. Advocate for yourself. If
Yeah.
your doctor's not taking you seriously or just says it's stress or you're getting older, get a second opinion.
Definitely. Knowledge is power. The more you know about hypothyroidism, the better you can manage your own health or help someone you know who might be dealing with it.
This has been an awesome deep dive. We uncovered some really cool facts about hypothyroidism, and hopefully our listeners are feeling more informed and empowered. Until next time, stay curious, keep learning.
And take care of yourselves.